Gastroesophageal reflux disease, GERD. Definition. Gastroesophageal reflux disease is a condition where stomach acid persistently and regularly flows up into the esophagus. The acid in the esophagus causes heartburn and other symptoms, as well as possible tissue damage. Gastroesophageal reflux disease, or simply GERD, is the excessive backflow of gastric or duodenal contents, or both, into the esophagus and past the lower esophageal sphincter, LES, for a sustained length of time without associated belching or vomiting. Causes. Gastroesophageal reflux disease occurs in people of all ages, and sometimes for unknown reasons. In short, GERD occurs when the sphincter at the bottom of the esophagus becomes weak, or opens when it should not. GERD occurs more commonly in people who are overweight or obese because of increased pressure on the abdomen. Pregnant, due to the same increased pressure. Taking certain medications, including some asthma medications, calcium channel blockers, antihistamines, sedatives, and antidepressants. Smoking, and being exposed to second-hand smoke. Hiatal hernia is a condition where an opening in the diaphragm lets the top of the stomach move up into the chest. This lowers the pressure in the esophageal sphincter and raises the risk of GERD. Pathophysiology. Symptoms. The main symptom of GERD is heartburn. Heartburn is discomfort felt behind the breastbone as a burning sensation. It tends to get worse if the person lies down or bends over, and also after eating food. However, not all people with GERD experience heartburn, and there are other possible symptoms. Nausea or vomiting. Bad breath. Respiratory problems. Difficulty or pain when swallowing. Tooth decay. Diagnosis. There are several possible tests to diagnose GERD, including history taking, physical examination, esophageal pH and impedance monitoring. This measures the amount of acid in the esophagus while the body is in different states, such as while eating or sleeping. Upper gastrointestinal, GI, endoscope. This is a tube with a camera attached, which is used to inspect the esophagus. A small sample of tissue may also be taken at the same time in a biopsy. Upper GI series. This is a type of X-ray that shows up certain physical abnormalities that might cause GERD. Esophageal manometry. This measures muscle contractions in the esophagus during swallowing. It can measure the strength of the sphincter. Brevo wireless esophageal pH monitoring. In this test, a small temporary capsule is attached to the esophagus. This measures the acidity continuously for around 48 hours. Management. GERD will often be treated with medications before attempting other lines of treatment. Proton pump inhibitors are one of the main pharmaceutical treatment options for people with GERD. They decrease the amount of acid produced by the stomach. Other options include H2 blockers, proton pump inhibitors. These are another option to help decrease acid production. Antacids. These counteract the acid in the stomach with alkaline chemicals. Side effects can include diarrhea and constipation. Prokinetics. These help the stomach empty faster. Side effects include diarrhea, nausea, and anxiety. Erythromycin. This is a type of antibiotic that also helps empty the stomach. Surgical options. If lifestyle changes do not significantly improve the symptoms of GERD, or medications do not have the desired effect, a gastroenterologist may recommend surgery. Surgical treatments include fundoplication. The surgeon sews the top of the stomach around the esophagus. This adds pressure to the lower end of the esophagus and is generally successful at reducing reflux. Endoscopic procedures. This is a range of procedures include endoscopic sewing, which uses stitches to tighten the sphincter muscle, and radiofrequency, which uses heat to produce small burns that help tighten the sphincter muscle. Diet. Certain foods may trigger GERD symptoms in some people. These include greasy foods, spicy foods, chocolate, peppermint, coffee, foods containing tomato products, alcoholic drinks, If you are avoiding these types of food and still experience regular heartburn, it is important to visit a doctor as there may be other underlying issues causing the symptoms. Nursing management. Nursing care planning goals of gastroesophageal reflux disease, GERD, involves teaching the patient to avoid situations that decrease lower esophageal sphincter pressure or cause esophageal irritation. The following are 7 nursing care plans for gastroesophageal reflux disease, GERD. Imbalanced nutrition, less than body requirements. Acute pain. Imbalanced nutrition, more than body requirements. Risk for aspiration. Deficient knowledge. Anxiety, pediatric. Risk for injury, pediatric. Prevention. Other lifestyle and behavior changes can help relieve GERD include: eat moderate amounts of food and avoid overeating. Stop eating 2 to 3 hours before sleeping. Quit or avoid smoking. If a person is overweight, losing weight can help prevent symptoms. Do not wear clothing that is tight around the abdomen. Sleep at a slight angle with the head slightly elevated. Complications. GERD can worsen and turn into other conditions if left untreated. These include esophagitis. This is an inflammation of the esophagus. Esophageal stricture. In this condition, the esophagus becomes narrow, making it difficult to swallow. Barrett's esophagus. The cells lining the esophagus can change into cells similar to the lining of the intestine. This can develop into cancer. Respiratory problems. It is possible to breathe stomach acid into the lungs, which can cause a range of problems including chest congestion, hoarseness, asthma, laryngitis, and pneumonia.
So guys, thanks for watching my video. You can like and comment on my video, but don't forget to subscribe my YouTube channel to watch quality content like this. Thank you guys.